And I was almost giddy walking into the English department again.
That was great.
And because, once you leave, it's hard to go back, right? And it's such a great opportunity to be able to come back and be a part of how I can really make formal this passion that I've sort of been, harboring for in the humanities and medicine, and to be a part of a new medical school, and not just a new medical school, but a new medical school that is fundamentally trying to shift the practice of medicine. And I can talk a little bit about that because I think it's relevant actually to a focus on the humanities and medicine.
When Professor Bremen told me about TILTS, I Googled Dr. Rita Charon and I saw her TED Talk, and that really spoke to me because it's something really obvious, but it's also something that I'd never thought about before, just the idea of listening and the idea of storytelling in medicine, and how it's really easy to just look at a patient as a list of symptoms and diseases, and you forget that there are people behind it. So I think the science classes have definitely given me inspiration in creative writing. The last poem I wrote was about me reading a neuroscience textbook.
The importance of creating that trust between patient and doctor through stories, through this shared narrative, I think this seems really important.
I'd sort of known that there was this large and vibrant field called the Medical Humanities, but I didn't really know much about it. So over the past 5 years, I've kind of plunged in and have been extremely stimulated and moved by a lot of what I've seen about what's going on, both in medical schools, in medical practices, and also more within traditional humanities departments.
To begin with these ethical dilemmas where there is no good answer and there's no right answer, and how they answer this particular situation is going to depend on what they value in terms of patient autonomy, or the physician's power, which is often a big thing with doctors. So that dealing with ambiguity and being comfortable with it, if we ever are, I think is a really important thing.
People are really exploring the role that literature and other arts can play in helping us better understand and perhaps even affect how health, illness, and healing are experienced by patients, by doctors, by family members, by other caregivers.
Our mission is to revolutionize how people get and stay healthy. And so that implies a lot of commitment to the community. In fact, for those who are aware of how Dell Medical School came about, it came about after the citizens of Travis County voted on a property tax to build the new medical school to improve the health of Travis County. That is our mandate. It is not to make scientists.